Hello everyone, today we will discuss topic about role of physiotherapy in intensive care unit. First of all, what is goals in a intensive care unit of physiotherapy role? What is the goal of physiotherapy in intensive care unit? First of all, improve or maintain normal or baseline ventilation oxygenation. You should maintain or improve normal baseline ventilation and oxygenation. Second, improve or maintain musculoskeletal system with function limit. How you maintain musculoskeletal system? With the improve range of motion, roam, or improve muscle strength or endurance, or prevent joint deformities, contracture. Third, improve circulatory system function. Fourth of all, improve or maintain neurological system and cognitive status within functional limit. Fourth, improve or maintain level of functional status within patient tolerance. Now we are talking about assessment. What is assessment? In the physiotherapy and ICU assessment, cardiovascular assessment of respiratory system, assessment of neurological system, assessment of renal system, assessment of hematological system, gastrointestinal system. In assessment, cardiovascular system, heart rate and rhythm, arterial pressure, central venous pressure, pulmonary arterial pressure, and pulmonary artery wedge pressure, are also known as pulmonary capillary wedge pressure. After cardiovascular system, next is neurological system. In neurological system, level of consciousness, Glasgow Coma scale, pupils, size of pupils, reactivity of pupils, and equality, comparing pupils. After that, cerebral. Next is cerebral perfusion pressure is less than 70 mmHg. Cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure. Intracranial pressure is less than 10 mmHg. After the neurological system assessment, next is renal system. In renal system, what is in renal system? What may be here? Let's check it out. Assessment of fluid balance, measure of intravascular volumes, urine output, serum electrolytes, and ABG, arterial blood gas. Gastrointestinal system. In gastrointestinal system is nutritional support, routes of administration, enteral, parenteral, oral. After gastrointestinal system, respiratory system in which auscultation, percussion, expansion, chest x-ray, mode of ventilation, humidification, oxygenation therapy, respiratory rate, airway pressure, EBG, arterial blood gas, and sputum. In respiratory system assessment, general observation, patient position, respiration, airway endotracheal, tracheostomy, ventilator mode, of vital signs, temperature, BP, RRH, RSPO2, tubes, CV line, peripheral line, chest tubes, catheters, and drugs. Examination, auscultation, respiratory pattern, checking of respiratory pattern, cyanosis, clubbing, radiography. Goals of respiratory goals: prevent accumulation of secretion, preventing of more secretion, improve mobilization and drainage of secretion, improving of mobilization, drainage of secretion, promote relaxation to improve breathing pattern, improve respiratory function, promote improved respiratory function, improve cardiopulmonary exercise tolerance. Precaution of respiratory system: untreated tension, pneumothorax, status asthmaticus, immediately following intracranial surgery, head injury with raised ICP, osteoporotic bones, recent acute myocardial infarction, unstable vitals, and sutures and intercostal drainage. Physiotherapy technique: gravity assisted positioning, manual technique, manual hyperinflation, airway suctioning, chest mobilization. Physiological effect of positioning: optimizing oxygen transport by improving VRQ mismatch, increase lung volume, reduce the work of breathing, minimize the work of heart, enhance mucociliary clearance, postural drainage, clearing lung secretion technique. Postural drainage is clearing lung secretion technique.